Idiopathic Pulmonary Fibrosis and Prevention of Idiopathic Pulmonary Fibrosis according to WHO standards. Hello friends. In daily life, small changes related to breathing are very easily overlooked, leading to unpredictable consequences for health later on. If these manifestations are not correctly identified and monitored in time, they can progress into dangerous chronic lung diseases, affecting the long-term quality of life of each person. Conversely, when detected early, many lung problems can be completely controlled, helping to maintain stable respiratory capacity and limiting serious complications. In this video, we will along with you analyze early signs of lung disease from a scientific perspective, based on current medical guidelines and clinical cases of pulmonary fibrosis. You will understand why seemingly very small changes carry important meaning, and when a respiratory symptom needs to be considered a serious warning. Before going into the detailed content, please subscribe and turn on notifications for the MMM channel with the access name at MMNeutube 1 in English and the LQT channel with the access name at YouTube to continue accompanying us in the series of healthcare and disease prevention videos throughout the human life cycle. And now we begin the main content. To start learning about the danger of respiratory diseases, we need to focus on idiopathic pulmonary fibrosis, a medical condition that the World Health Organization identifies as a chronic and progressive lung parenchyma injury. One is, let us together analyze the diagnostic process based on typical clinical cases where changes in lung structure begin from the alveoli. In the diagnosis of idiopathic pulmonary fibrosis, the first sign is usually the appearance of scars on lung tissue, making the lungs become stiff and less elastic. The World Health Organization emphasizes that identifying functional symptoms such as shortness of breath during exertion and persistent dry cough is the most important starting step. In clinical cases, patients often describe a feeling of being unable to breathe deeply, accompanied by coughs without phlegm, but appearing continuously for many months. When medical experts perform lung auscultation, they will search for dry crackles, a specific type of sound reflecting the state of fibrotic alveoli trying to open. This shows that the disease has begun to cause physical changes in the respiratory structure that, if without medical expertise, we very easily overlook or confuse with common upper respiratory tract diseases. 2 is the importance of combining advanced diagnostic imaging techniques and respiratory function assessment to confirm the disease state according to international standards. An accurate diagnostic process requires the use of high-resolution computed tomography to observe reticular or honeycombing injury images at the lung bases. These are undeniable imaging evidences of lung parenchyma destruction. According to guidelines from the World Health Organization, performing lung function tests to measure carbon monoxide diffusion capacity is extremely necessary to assess the degree of damage to the alveolar capillary membrane. If this capacity declines, it means that oxygen cannot enter the blood effectively, leading to a state of fatigue and reduced exercise capacity of the body. In some more complex cases, doctors may need to perform bronchoscopy to collect bronchoalveolar lavage fluid, helping to exclude other causes of inflammation or interstitial lung diseases related to the immune system. This meticulousness in each diagnostic step ensures that you will have a correct treatment roadmap from the beginning, limiting unnecessary damage caused by using the wrong medication. 3 is the correlation between risk factors and the progression of idiopathic pulmonary fibrosis that each individual needs to deeply understand to protect themselves. The World Health Organization has pointed out that although the exact cause of idiopathic pulmonary fibrosis has not yet been fully determined, There are clear influencing factors that increase the speed of fibrosis. People with a long history of tobacco smoking or regular exposure to types of fine dust, metal dust, and wood dust in the labor environment have a much higher risk. The continuous impact of these toxic dust particles causes a state of prolonged microinflammation, stimulating fiber cells to overproduce and form scars. In addition, genetic factors and age also play a certain role in the development of the disease. Understanding these risks helps you have a more objective view of your own health status, thereby having a more proactive attitude in seeking the earliest possible medical intervention solutions. 4 is the management of comorbid medical conditions and acute exacerbations of lung disease to reduce the mortality rate and improve the quality of life. One of the important recommendations from international medical organizations is the control of gastroesophageal reflux disease, because the inhalation of small acid particles from the stomach into the lungs can worsen the fibrosis process. In addition, recognizing acute exacerbations of the disease, which are sudden periods of respiratory function decline without a clear cause, is extremely important because they often lead to very heavy consequences. You need to closely monitor every change in the level of shortness of breath or the appearance of slight fevers to be able to be hospitalized for timely treatment. The use of current antifibrotic drugs, although unable to cure completely, has proven the ability to slow down the rate of lung function decline, helping patients have more time to live and maintain relatively stable daily activities. 5 is synthesizing the most comprehensive and effective prevention solutions according to World Health Organization standards to protect sustainable respiratory system health. This is exactly the core content that the World Health Organization desires to convey to every citizen across the globe. First of all, the leading and non-negotiable solution is the complete cessation of smoking and staying away from passive smoke sources, because tobacco is the #1 enemy of lung alveoli. Next, the World Health Organization recommends that countries and individuals need to have measures to improve air quality, including the use of clean fuels in cooking and installing good ventilation systems at residences as well as workplaces. Besides that, performing full vaccination according to the schedule, especially the annual flu vaccine and pneumococcal vaccine, is considered a solid shield helping to prevent severe lung infection episodes. In toxic working environments, strictly complying with labor safety regulations and using specialized masks is a mandatory condition to prevent fine dust from penetrating deep into the lung parenchyma. Finally, the World Health Organization emphasizes the importance of maintaining a healthy lifestyle with a diet rich in vitamins and appropriate physical exercise to improve overall resistance for the body. Performing daily breathing exercises not only helps improve lung capacity, but also helps the spirit be refreshed, reducing psychological pressure for the patient. All of these solutions, when implemented synchronously, will create a tight lung protection system, helping to reduce the burden from chronic lung diseases for the community. Finally, it is necessary to emphasize that lung health does not decline in one day, but is affected gradually over time by many negative impacts. Every time a persistent cough is ignored, every time slight shortness of breath is underestimated, and every time a health check is delayed, they all contribute to increasing the risk of serious respiratory injury in the long run. International medical organizations all affirm that early identification of abnormal lung signs is the most important foundation to protect respiratory capacity and quality of life. When people correctly understand the signals that the body emits and act timely, the burden of lung disease can be completely minimized. Actively monitoring respiratory health, not only helps prevent disease progression, but also contributes to maintaining a more active and sustainable life. If you find this content useful for yourself and your family, please subscribe and turn on notifications for the channel with the access name at YouTube 1 in English and the LQT channel with the access name at LQTYOUTUBE in Vietnamese. On these two channels, we will continue to share in-depth content on protecting the lungs, liver, kidneys, cardiovascular system, and common non-communicable diseases. Health does not come from luck, but is the result of correct understanding and choices made at the right time, in the right way. Thank you for following the entire content of this video.